It's midnight. The lights are off, but one tiny cry fills the room. You pick up your baby, rocking gently, whispering softly, but the crying doesn't stop. You've checked the diaper, tried feeding again, and still, the tears keep coming. Your heart sinks because you've done everything right, or so you thought. The truth is, sometimes it's not hunger or tiredness, it's trapped air. A simple bubble of gas sitting in your baby's tiny tummy, turning comfort into pain. And that's where burping comes in. In the next few minutes, you'll learn how to burp your baby the right way, the gentle, effective way that brings quick relief from colic, gas, and reflux. Parents call it magic, doctors call it science. Either way, it works. Every time your baby drinks milk, whether from breast or bottle, they also swallow tiny bits of air. That air doesn't just disappear. It gets trapped inside the stomach, building pressure. Imagine trying to nap after swallowing a balloon. That's how it feels for your baby. The air bubble pushes milk upward, causing spitting up, discomfort, even reflux. The baby cries not because they're hungry, but because they're bloated and helpless. Burping isn't just a cute sound. It's your baby's body releasing pressure, finding comfort, and finally breathing freely. Doctors say most fussiness after feeding comes from trapped gas. When you burp your baby, you're helping that air escape before it turns painful. One gentle pat can turn hours of crying into peaceful sleep. That's how powerful proper burping really is. Burping isn't about timing the clock. It's about reading your baby. If your baby pulls away from the bottle, squirms, or frowns mid-feed, it's time for a pause. That's your cue. Burp them halfway through. Then after the feeding is done, burp again. Most babies need to burp 2 to 3 times per feeding. Newborns especially swallow more air because they feed fast. And if your baby falls asleep while feeding, don't skip the burp. Just hold them upright for a few minutes. Even a small burp helps. Burping isn't just for the baby with gas or reflux, it's for every baby. It keeps their tiny digestive system calm and balanced. The trick is patience. A few gentle pats can save you both from long nights of crying and discomfort later. There's no one perfect burping style. Every baby is different. But 3 positions are proven to work for most. First, the over-the-shoulder. Hold your baby close to your chest, head resting gently on your shoulder. Support their head and back, then pat softly upward. You'll feel the relief in their body when that bubble escapes. Second, the sitting up position. Sit your baby on your lap, facing sideways. Support the chest and chin with one hand, not the throat, and use the other hand to pat the back. It's gentle but powerful. Third, the tummy on lap method. Lay your baby face down across your lap with the head slightly higher. Gently pat their back. This position helps gravity do the work. Try each and see which one your baby loves most. Every burp means comfort, calm, and a happier baby. Sometimes burping alone isn't enough. If your baby often spits up or cries after feeding, small changes can make a big difference. Keep your baby upright for at least 10 to 15 minutes after each feed. It helps milk settle and reduces reflux. Avoid overfeeding. Smaller, more frequent feeds prevent extra gas. Check the bottle nipple. If the milk flows too fast, your baby swallows more air. If you're breastfeeding, make sure the latch is deep and comfortable. Gentle tummy massages or moving your baby's legs in a bicycle motion can also help release trapped gas. And here's the secret: stay calm. Babies feel your stress. The more relaxed you are, the faster they settle. Burping is a small act, but for a gassy, colicky baby, it's life-changing. If your baby still cries after trying all burping methods, don't panic, but don't ignore it either. Some babies have stronger reflux or sensitive tummies. If you notice frequent vomiting, poor feeding, arching the back in pain, or not gaining weight, it's time to talk to your pediatrician. These could be signs of reflux disease or food intolerance, not just gas. Remember, crying is a baby's only language. When it feels different, listen closely. Pediatricians can guide you on feeding techniques, formulas, or medical checks if needed. Most babies grow out of reflux and colic by 4 to 6 months. Until then, your love, patience, and gentle care are the best medicine. You're not failing, you're learning. Every parent has been here, and it gets easier every day. So, what have we learned? Burping is more than a sound, it's comfort. It's relief. It's your baby's way of saying, thank you. Remember the steps. Burp halfway through and after feeding, use one of the 3 trusted positions, and keep your baby upright for a while after feeding. Try tummy massage or gentle movements when needed. Watch for signs of discomfort and never hesitate to ask your doctor for advice. Parenting is not about being perfect, it's about being patient. Every burp, every cry, every sleepless night is part of your baby's growth and your journey, too. You're doing better than you think. So take a deep breath, smile, and keep going. If you found this video helpful, like, subscribe, and share it with another tired parent who needs a little hope tonight.